At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Centers.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. But as I like to start off each and every week, I'd like to say hello to our loyal listeners. Thank you for listening each and every week. And a special hello to anyone who is new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on 6:20 a.m., KHB 6:20 a.m., from 9 to 10 in the morning. Last week I had to run a tape. I had to get a dental procedure. I'm beginning the long process of a dental implant, which I did not know took almost a year time. I have a great dentist who actually is a patient of mine. Right down the street is doing a great job with me. But it is a long process, and I had some bridge work. I had a little unfortunate motorcycle accident when I was 16, and I ended up losing 2 permanent teeth and had a bridge. And from there on out, this seems to be a more permanent solution and less decay and less problems. So I did run a tape last week, so that's why I was not live. This week we are definitely back live, and we're going to continue on with some of the nutritional items we promised you into 2 weeks ago when we touched on the 20 health tips from 2016 and the action plan for 2017 goals you should be setting for your health and for the rest of your life, including 2017. Again, this is from Macola.com. I want to give you a little preview for next week as we get in through the action plan for 2017. There's some interesting, I always am out there reading different research publications and different articles on health, looking for good things to talk about on my show, as well as just keeping myself up to date on the latest health tips. And, of course, we have our newsletters, the Daily Health Update newsletter and the monthly In Good Hand newsletter, which I'll touch on here in a few moments. And I'll tell you how you can sign up for that free of charge. It's sent to your email, again, at no charge, and I'll tell you how to do that here in a few moments. But next week, hopefully, we'll get into the Dynamic Chiropractic publication, talking a little bit about natural remedies for menopause. There's a lot of people out there that are having difficulty with hot flashes, different menopausal-related symptoms. So we'll definitely touch on some natural approaches to menopause next week on BackTalk, so definitely stay tuned for that. This week, again, we're going to be continuing the action plan for 2017, and the rest of your life is the title of the article, again, from Macola, MERCOLA.com, and we'll touch on that and finish that up hopefully this week here in the second half hour of BackTalk today. Of course, the American Back Centers, as we talk about each and every week, we are not your typical chiropractic office. Since 1994, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, bulging disc, failed back and neck surgery, sciatica stenosis, and degenerative disc disease. We've seen some of the most difficult cases here at the American Back Centers, patients that have been to every doctor known to man, pain specialists, surgeons, orthopedics, physical therapists, even sometimes other chiropractic doctors, where now the adjustment was helping and doing great for the patient, and in some cases the patient does develop a disc problem that does not respond to the adjustment, and that's where we come in with a Vaxi therapy, a treatment specific for a more difficult disc-related issue, herniated disc, extruded disc, foot drop, those type of more serious sciatica-related issues. I have to excuse myself. I have from this dental procedure, I have what they call a partial in my mouth, so I may sound a little bit different today, so I do apologize. I'm going to be having this for the next almost 8 months, so I guess you'll have to get used to it. But I apologize if I sound a little raspy or a little bit different, but the partial does make me talk a little bit differently. But that will be done with here in about 8 months. So hopefully, again, I apologize. I don't sound a little bit annoying or different, so I apologize for that. But, again, so we talk about the American Back Centers starting back in 1994. Actually, over 40 years ago, the American Back Center started with Dr. Dennis Miskovich. But in 1994, we started specializing in these difficult disc-related issues. Dr. Miskovich saw the groundbreaking research done by two neurosurgeons, Dr. Ramos and Martin. And this was published in the Journal of Neurosurgery way back in 94 again, showing for the first time and still to date, and I say still to date because there's so many of these so-called decompression devices, and I talk about it all the time, traction tables, there's even these pump-up devices that pump up around your neck, things that you lay on that pump up, and they claim decompression. So the term decompression is so loosely used, if you want to use that term, loosely used these days, for just about anything. So when you hear the term decompression, you have to take it with a grain of salt. It doesn't mean much when you actually know what decompression means. To actually decompress, you're actually opening up, allowing fluid and nutrients back into the disc, creating negative pressure. And in fact, some of these glorified traction devices claim that they do this, but I would ask the doctor, produce the research. Of course, if they produce the research, and the only research that has been done to prove this in real-life subjects was the Ramos and Martin article published in the Journal of Neurosurgery way back in 1994. If they produced that, that was only done on vaccine therapy, and again, most of these other tables weren't even developed into the year 2000 or after. So you know for sure that that doesn't apply to that. Number one, we know it was only done on VaxD, but of course those tables weren't even developed when that research was done. So it makes you wonder why they continue to make these claims. With VaxD, you don't have to worry about that. As a doctor, I know I can sleep at night knowing, number one, I've seen thousands of patients come through our door that have done well. We've even had professional athletes. We talked about even Forrest Whitaker was here. Not to see me, he came for the VaxD because he was starting it down in Georgia and continued to hear when he was filming a movie 2 years ago. These people see the results. They see the science. Patients. As a patient, you would want something that's researched, has a proven track record, backed by real, solid scientific evidence. And that's what you have with VaxD. And there's people going and spending upwards of $8,000, $9,000, $10,000 on treatment programs for these glorified traction devices. You hear them out there. They claim that they have the best disc treatment out there. They have centers called disc centers and different things like that that are out there claiming to have this revolutionary treatment. But when you look back, VaxD's been helping people with the only FDA-approved, safe, clinically proven treatment for over 20 years now, backed by the research showing that it truly is still the only device that decompresses the disc, creating that negative pressure, reducing the pressure within the disc in the spinal canal, allowing the retraction through the vacuum effect that only VaxD has been proven to do, I should say, in clinical research, again, published in the Journal of Neurosurgery back in 1994. This is a peer-reviewed research study proving that it does what it does. Now, there's people that have peer-reviewed research showing success with their traction treatments, but doesn't really show that they're actually pulling the disc back into place. Any traction device, any inversion table in some cases can give you some relief of your disc-related condition, but is it really pulling the disc back into place? Is it really pulling the fluid and nutrients back into that compressed, degenerated disc? And that's the cause of the problem in most cases, is the compression on the spine. I try to tell patients that when they're coming in to our office, they're contemplating surgery, they're contemplating pain shots, epidurals, pain medication. Of course, we all know pain shots, epidurals, pain medication, over-the-counter prescription is just a Band-Aid. In some cases, the disc condition can resolve itself. If it's mild, you take pain meds, you get pain shots. The condition through physical therapy, chiropractic can take care of itself. And definitely with chiropractic, as far as adjusting the bone, realigning the spine, allowing the disc condition to heal. Great success with that. But if you're not successful and you've tried those procedures, and physical therapy alone, as I always mention, does not really address the actual disc. They're trying to strengthen the muscles surrounding the area. In some cases, the physical therapy can actually make the disc problem worse by actually irritating the inflamed disc. Then we talk about surgery. We talk about how they snip off a piece of disc, whether it's a laser procedure, the scalpel. We know the lasers anywhere between $20,000, $30,000, $40,000 out of pocket because it's not covered by insurance. But when you look at it closely, it's no different than the scalpel procedure. They're still just snipping off a piece of the disc through a laser or through a scalpel. No different whatsoever, but you're spending tremendous out-of-pocket expense for this so-called safer, less invasive laser procedure. And then when that doesn't work, we talk about how it doesn't address the compression, the bone spurs, the arthritis still continues to occur, the fusion that wants to occur of the vertebrae, the compression, the further degeneration of the disc, starving the disc that occurs even after the surgery, the areas above and below compensating. Then they want to fuse the spine, put the rods and screws in there, which we know should be a last resort, very invasive. And we're not even getting to the possible scar tissue, the infection, the bleeding, the blood clots that can occur with any surgery, especially spinal surgery. Then they put the rods and screws in, and if that doesn't work, and we talk about how that's fixing the segment, that takes care of the compression. Yes, it does take care of the compression, but then the segment's not moving. It should be moving. It's not allowed to move because it's fused. So then the areas above and below have to compensate, kind of like taking a link out of a chain, and then they start to suffer. So then it's only a matter of time till they have to go in and do another fusion, another back surgery. And then the patient becomes crippled, disabled in many cases because now their entire back is fused. You basically have no movement in your low back whatsoever at that point. And I know this. My father-in-law had his entire back fused before he met me, before he knew me, and he's been disabled since the age of 52. He can't even cut his own grass because of severe pain. And most people won't touch you at that point because your back's fused. You can't do much as far as physical therapy, chiropractic, whatever it may be, therapy-wise, because your back is fused. So you want to avoid that. So again, actually we have a very safe, natural alternative to back surgery. Again, the only FDA-approved, safe, clinically proven non-surgical disc treatment out there. Again, we've been doing it since 1994, over 20 years. Our protocol, of course, is physician-directed. Our protocol engages other modalities as needed on a case-by-case basis. Again, we have over 20 years of experience, one of the most experienced facilities in this area, if not the country, because we've been doing this longer than most people. We've seen thousands of patients come through our door, some of the most difficult cases in many cases, and we screen out and decline candidates whose medical records and evaluation indicate we're unlikely to help them. So if we cannot help you, we will refer you out. And we do work with some good surgeons in the area if we do feel that we cannot help you and surgery is your only option. But again, I cannot overstress that, your only option. It should resort because we see people come in here each and every day with failed back surgery, failed neck surgery as well. We'll talk about that here in a few moments, how we can help you with neck issues. But the VAC-C specifically for the lower back and the thoracic spine region. So VAC-C is a time-tested treatment, very safe treatment, very cost-effective treatment, used in over 300 facilities worldwide. It's all over the world now, not just here in the U.S. There's a few hospitals, medical clinics, even orthopedic surgeons in private practice have VAC-C in their office. Chiropractic and physical therapists use this worldwide. This, of course, is VAC-C, standing for vertebral axial decompression. Again, I hesitate to use the term decompression because of what I just mentioned, how it's so loosely used, and VAC-C, again, was the first to name itself decompression, and it is true. When I say true, you look at the research, true decompression, creating that negative pressure, forming that vacuum, only VAC-C has done the research. Not research showing that patients have done well with a particular treatment, but research showing that it actually does what it says it does, and that's important. How do you know that the procedure is actually doing anything to your disc? If not just giving you temporary relief, like you would have with a traction device or inversion table, but permanent correction, structural correction to the disc, restoring the fluid to that compressed disc, opening up the disc height, and creating that negative pressure, that vacuum, to pull the disc material back into place. With VAC-C, you have the proof. You have the research. You have the before and after MRIs showing the before MRI and the after effects, the changes structurally that occur within the disc. So as I ask each and every week, if you're out there listening, you yourself, you know someone who has had back or neck pain, unresponsive to your current treatment, you want to avoid further pain medication, you're going to a pain clinic, getting pain shots, epidurals, you've had surgery, you're contemplating surgery, you've had a second, third, or fourth or more failed back surgeries. Your symptoms are radiating to your hip, your buttocks, your groin, down your leg, numbness and tingling, weakness in your legs. You may be diagnosed with spinal stenosis. That stenosis may be due to a disc narrowing that canal, creating that spinal stenosis. You may have a foot drop. Those are all very common presentations we see here at the American Back Centers with our treatment. So again, Vaccine is the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. Whether you have a herniated, degenerated disc, posterior facet syndrome, degenerative joint disease, arthritis, degenerative disc disease, sciatica, stenosis, and numbness and tingling. Also extremely effective with failed back surgery conditions and with people who have had multiple failed back surgeries. Of course, the vaccine treatment has been conducted over a period of years, over 20 years now, since 1994. The unique vaccine treatment table is protected by patents issued in the U.S. as well as internationally. Of course, this breakthrough technology was developed by Dr. Alan Dyer, the former Deputy Minister of Health of Canada, Ontario, Canada, who pioneered the research on the heart defibrillator, which we all know is an extremely important invention used all over the world. Research to develop the vaccine treatment was conducted over a period of 6 years with combined efforts of physicians, engineers, and technicians at major hospitals. So, of course, there's over 300 facilities. We talked about medical doctors, orthopedic surgeons, physical therapists, chiropractors doing VaxD. So we are our doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Don't wait until your condition worsens. Call us today. Our toll-free number for the American Back Centers here in Wexford is 1-888-222-8293. Again, 1-888, not 1-800, 1-888-222-8293 or 724-935-3300. Also, I'd like to give out the fax number because we do encourage you, if you want to fax over any reports, whether it's an X-ray report, CT or MRI report. Remember, you can't fax over the films. They don't fax very well, but the reports. So typically there's a typewritten report when the radiologist takes a look at the films and does his interpretation. That's what we want. So if you can fax that over, make sure you put your name and address, actually just your name and phone number. We don't need your address. Your name and phone number on the fax so we can call you back and talk about it. In some cases, we have people coming from many, many hours away. Coincidentally, we do have a list of hotels on our website if you need overnight lodging when you come and visit us from out of state. We have people from all over the country coming to our office. If you're coming from hours away, in some cases, you can fax over your report. We can take a look at it and then give you a go-ahead first before you make the trip out to our office. So our fax number is 724-935-3321, 724-935-3321. That is our fax number. Again, our office number is 724-935-3300 or toll-free 1-888-222-8293. You can also request an appointment, and we usually get back to you within 24 hours right on the website. Our web address is www.americanbackcenters.com, www.americanbackcenters.com. You can request an appointment. You can go on our website. You can sign up for our daily health update newsletter, which is health tips and an inspirational quote. It's sent to your email free of charge each and every day. If you have time to look at it, you can look at it. The next day you can gloss over it if you don't have time. So it's just quick and easy. It's just one page with health tips that are updated each and every day, and a great way to start off your day, but with a great quote for the day. you automatically get signed up for the monthly In Good Hands newsletter. This is a wonderful newsletter, and it's amazing that it's free, because some of the greatest minds in the country contribute to this, and you get this free when you sign up for the Daily Health Update newsletter. It's a more lengthy, anywhere between 7 and 10 pages, if not more or less than that, but definitely longer than 1 or 2 pages. It comes out once a month, going over some of the latest health tips and health information across the country. Updated health information, of course. That's sent out once a month. It's called the In Good Hands newsletter. It also shows you a link to our blog, where there's a wealth of health information on there as well. You can go right to the blog by going to drpeterpedduziblog.com, directly to the blog, if you'd like to see that as well. So again, sign up for our Daily Health Update newsletter by going to our website and signing up for the newsletter. You automatically get signed up for the monthly In Good Hands newsletter as well. So definitely check that out at www.AmericanBackCenters.com. That's with an S, AmericanBackCenters with an S.com. Also visit our Facebook page. It's American Back Centers Pittsburgh. Again, American Back Centers Pittsburgh is our Facebook page. If you have a second, like our page. We'd greatly appreciate that if you could take a second to like the American Back Centers Pittsburgh page. Also, we have some articles that we touch on the radio show on there as well. We sometimes give you a preview of what we're going to be talking about. We haven't updated anything yet today because we ran a tape last week, and we're going to be talking about the same things that are up on the Facebook page today. But we try to update to give you a preview or give you an idea of what we're going to be talking about on the show if you visit our Facebook page on a weekly basis. So again, like our page if you have a second. Again, American Back Centers Pittsburgh. We would greatly appreciate that. All right, in addition to the vaccine, we have many other great treatment options, many unique services all under one roof right here at the American Back Centers. We also offer cervical disc treatments. If you have a cervical disc problem, bulging, herniated disc in the neck region, degenerated disc, failed neck surgery, you're contemplating neck surgery, you have what's called cervical radiculopathy. I apologize. This partial is killing me today with my tooth, so I'm having difficulty pronouncing things today. I apologize. And any type of issue where you have numbness, tingling down your arms, numbness in your fingers, hands, those are things that we definitely treat here very effectively with our cervical disc protocols and our disc problem. And again, when we talk about VAXI, our protocol is very unique. We continue to perfect our protocols over the years, and we continue to get better. That's why we have one of the highest success rates in the country, not just this area, in the country, instituting this type of care. Over 92% success rate with our VAXD and our cervical disc programs. Again, we will not accept you if we don't feel you're not going to do well with the program. And in most cases, the patients follow the program. They follow our unique protocols. They will do well with our disc programs. We also have state-of-the-art therapy and rehab, individualized programs, ergonomic and postural instruction. We treat wrist, hand, finger, foot, ankle, and knee problems, the extremities, including tendonitis, rotator cuff, wrist problems, finger problems, trigger finger, carpal tunnel, frozen shoulder, and many, many other issues. We even do rehab post-surgery for hips and knees. Patients come in. They've been patients of ours. They get a script for therapy from their orthopedic. They want to come see us because they liked us. They like what we do. They know we do very similar, if not the same things that they would get at a physical therapist's office. Plus, we have more here. We have massage. We have disc protocols. If they have a disc problem, we also do we did the therapy and the rehab, and we do the chiropractic all together under one roof as opposed to just getting standard physical therapy. As I mentioned, we have a great massage therapist instituting deep tissue massage, myofascial trigger point therapy, acupressure, reflexology. Comprehensive nutritional consultations, we talked about this through standard process. We can send this out to you if you'd like to try it. It's called a symptom survey. A very comprehensive nutritional profile. Custom-made orthotics, a computerized digital scanning system. We'll talk a little bit more about this later on the show. Assessing for foot dysfunction. We have patients come in all the time. They've tried the old casting kit method where you put the foot into a cast. We used to do that here at the American Back Centers. But when you think about it, there's a lot of possible error through the patient stepping into the casting kit as well as the doctor placing the foot in the cast. Lots of potential error there. With the digital scanner, you're simply just standing on the 3D scanner. There's no error. It's very simple, so you're not pushing into a cast, which would create an impression error. If you push down on the toe, if you push on the back of the heel first, you're not pushing down directly with the entire foot as one unit, you can have impression errors. With the scanner, you don't have that. You're simply just standing on the scanning unit, and it's scanning your foot, giving you a more accurate interpretation of any possible foot issues. You can see it. We discuss it. There's weight bearing also assessed. Some patients will have more weight bearing on the right or the left. It shows you the percentage. It's very detailed, very complex, and very accurate. And patients love these because it really helps their problems. Whether it's a foot issue, arch issue causing a bunion, a heel spur, plantar fasciitis, or it's causing problems up that kinetic chain, knee issues, hip issues, even back issues. Sometimes neck issues can be related to a arch problem in the foot. So call us today if you'd like to try and come in for a consultation to see if you're a candidate for the custom-made orthotics. Acupressure treatment, we do a great job with example sinus issues, sinus drainage issues, respond very well to acupressure. We do that for patients when they come in with sinus pressure and pain, amongst other issues. We have in-house X-ray, nerve conduction, ultrasound testing done by an outside facility, Lakeside Medical, when it is needed for a patient. And we have very conveniently located MRI CT facility, North Pittsburgh Imaging, doing MRIs and CTs right across the street from our office. So if we need that, we can write you a prescription, and you can literally go right across the street, which is very convenient for our out-of-town patients. They can come out and get their MRI. We try to squeeze you in the same day that you're getting your imaging. You come on over. We take a look at the films the same day to save you another trip out here, especially if you're coming from a great distance. Also, I'm a certified personal trainer, so I can help you get back in the gym, as I always talk about, and do things correctly. So you're not hurting yourself. Remember, you have good intentions when you go in the gym, but in many cases, you end up hurting yourself by doing certain things incorrectly at the gym. So as we talked about, as we get back to VAXD, the VAXD, again, it's table and computer, because it's a computerized treatment, work with each individual patient, adjusting back tension, which in turn adjusts interdiscal pressure moment by moment. The computer adjusts the tension in small amounts so that the muscles in the lower back do not spasm or contract during the treatment, which allows for the decompression to occur. And that's, again, what makes VAXD unique, because the only VAXD does that. We do offer a free consultation, no cost or obligation. We sit down with you, answering all your questions. That's very important to note. Answering all your questions, we do encourage you to bring somebody in with you, if you can. Number one, to drive you out here, because you're probably in pain, and to make sure all your questions are answered. Of course, if you have any questions that are left unanswered, you can always call us after the consultation. We can definitely take your call and answer any more questions you have. We're here to help you. And again, we're going to do a detailed history, physical exam, look at your X-rays, bring those in. If you have any MRI, CTs, bring those in as well. We'll take a look at those as well. Patients remark that in many cases we describe things much better than even their neurosurgeon or the neurologist. In many cases, you're in and out the door with those people, and I hate to say that, but we spend time with you. We go over your problem in detail, answering all your questions and describing things thoroughly and making sure you understand what we're saying. And that's also helpful if, again, we talk about bringing somebody with you. You can bring in a spouse, family member, or neighbor. That would help as well. Again, we're very, very clear on what we're saying, but it's always nice to have somebody with you, again, and drive you out here if you're in pain. So we do offer that consultation, no cost or obligation. Again, call us toll-free, 1-888-222-8293 or 724-935-3300. Or you can go to the website, www.americanbackcenters.com, and request an appointment right on the website. We also have the DVD, the free DVD, on when Channel 11 WPXI did a medical breakthroughs report on our office. They broadcasted this on Channel 11 News about 10, 15 years ago. So even back then, they saw all the success that we had, and we continue to have, helping people with these difficult disc-related issues. So if you'd like a copy of this DVD, just call our office, give us your name and address. We'll send it out to you. It's also a great way for you to see VAXD in operation. You'll also see Dr. Miskovich answer some of the key questions that people have about VAXD, and there's some great patient testimonials on there as well. We also have some research papers we typically send out to you. The first paper, this research was actually done right here at the American Back Centers and published in the Canadian Journal of Clinical Medicine. Of course, we're very proud of that. That's why we continue to talk about it and toot our horn a bit, and I apologize for that. But we can send that out to you. We also have the Knife in the Back article, again, showing the failures of back surgery and why surgery is not the best approach for chronic back pain. We continue to send this one out because it's such a good article. It was published in the New Yorker magazine by Jerome Groopman, showing the failures of back surgery, specifically fusion surgery, and why even to date, still, it's such a money-making procedure. They continue to do it because it makes them money. $60,000, $70,000, $80,000, $100,000 per procedure, pre- and post-op, for these fusion surgeries. And what good does it do in most cases? It causes more harm in many cases. Scar tissue infection, bleeding, blood clots, rods and screws. Not a scenario that I would want to go under. We also have the blue workers' comp and the yellow auto accident booklet, again, showing you your rights, as I talk about each and every week. If you're injured at work, many people don't know their rights. They're taken advantage of by the insurance company, by the employer in some cases. Every day we see patients. I give this blue book to them in the office. Every workers' comp patient gets this blue book because they don't know their rights. They get sent for these independent medical evaluations, which are not truly independent. We all know this now. They're doctors, and the doctors are primarily wanting more work because they won't get another evaluation if they don't favor the insurance company. And their goal is to send the patient back to work, even if they're still in pain and still in need of treatment. And it's very unfortunate. So you need to know your rights. You need to know this. And this book is not a substitute for a good attorney, but most attorneys are happy, if not ecstatic, that their patient has read this book prior to needing an attorney because they didn't make the common mistakes that these people make unknowingly when they get hurt at work. So ask for the blue workers' comp book or the yellow auto accident personal injury book. If you've been hurt in an auto accident personal injury, you may need the yellow booklet. They're both free. Of course, if you've been hurt at work, you may have a disc-related condition or any type of low back, cervical, neck, or musculoskeletal issue. Give us a call. We have some of the greatest treatment options all under one roof right here at the American Back Centers. Of course, we have specific protocols, therapy protocols, chiropractic therapy, as well as massage, specific for whiplash cases as well. So if you've been involved in a car accident, you're sitting in a stoplight, somebody's not paying attention, they're on their phone, they slam into the back of you, you end up with a whiplash injury, or even worse, a disc injury in your neck, definitely give us a call because we are the place to come for those type of injuries because we have the best treatment options for that. All right, I want to give you a little bit more. We have this 24-page Keller booklet. You can also call and receive. Just call our office and ask for the 24-page Keller booklet describing VAXD therapy. And there's a lot of great things in here, what to expect, who's a candidate, talking about the different conditions, is VAXD right for me? All the research has been done in VAXD therapy. I'm going to give you a quick testimonial from this booklet. This is from a Jeff who received VAXD therapy. He goes on to state, I was brought into my VAXD treatment in a wheelchair. For 3 years, I had suffered from low back pain and sciatica in both legs and numbness in one leg. In the first week of VAXD treatment, I felt almost immediate relief. It was just getting better each day. At first, they sometimes had to help me off the table after treatment, but now I just get up and move around like nothing ever went wrong. I returned to normal activities, including yard work, and I'm eager to return to my golf game. From being in a wheelchair to being able to walk freely again without any pain, well, that's a big deal. And this is from a Jeff. Of course, can't give his full name. Received VAXD therapy. So there's many more testimonials, including doctor testimonials, that have used vaccine in their office. Sometimes even the doctors have been personal success stories with the vaccine, using it themselves. Of course, Dr. Alan Dyer, the inventor of the vaccine treatment, had a herniated disc, and he basically healed himself when he invented, with the help of some other doctors and engineers, of course, the vaccine therapy many, many years ago. And again, we're one of the first facilities to institute this because we saw that research when it came out in '94, and Dr. Miskovich purchased not one but two vaccine tables at that time, seeing that great research and the research that continues to be done, published in, for example, the Archives of Physical Medicine, Journal of Orthopedic and Sports Physical Therapy, Journal of Neurological Research. The list just goes on and on and on of all the peer-reviewed research that has been done on vaccine therapy. All right, before we get into the nutritional segments today, I want to give you a couple more things. Of course, we talk about the real question should always be, why would you even consider surgery with all its complications and lack of success, not including the normal risks that we see all the time, infection, bleeding, blood clots that can occur with any surgery. When vaccine is an option, remember, vaccine is a non-invasive treatment with a much, much higher success rate than surgery, pain injections, or physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner or first. Remember, vaccine addresses the structural issues, not just the symptoms, decompressing the disc, restoring the fluid content, taking the compression off the spine of the disc, relieving pain associated with low back pain, disc problems, herniated or degenerated, foot drops, sciatica, stenosis, numbness and tingling, and even failed back surgery conditions. And we see it all the time. National Institutes of Health state 9 out of 10 back surgeries not successful. British Medical Journal, American Medical Association state lumbar disc surgery not effective, not successful. The laser surgery, they try to claim that it's safer. Tremendous out-of-pocket expense, $20,000 to $40,000 out-of-pocket expense at the very least. Artificially inflated success rates. When you look at it, you look at the actual surgeons. Most surgeons choose not to do the laser procedure, as I've talked about on this show many, many times, because the scalpel in their own hand is much more precise. They have more control. They can determine how far they're going in much better by using their own hand and scalpel. And they still have to rip out ligament, bone, and tissue. And again, this is coming from surgeons, not from me. You have to rip out ligament, bone, and tissue before that laser even goes in, causing, in many cases, if not all cases, permanent damage. So then the question is, again, from a surgeon, quote, what therapeutic benefit does that laser even have at that time? So you have to make note of that as well before you make the choice of undergoing the knife or the laser in the case of laser disc surgery. I think we have a call. This is Dr. Pedduzi. Good morning.
Oh, thank you for taking my call. I wanted to ask you, about 3 or 4 weeks ago, you were reading an article to us, or parts of an article.
Yes.
And did you mention something about LED light bulbs, not that they were harmful?
Yeah, I was really surprised about that, too, because, guess what? We just built a house 3 years ago, and what did they put in those houses? LED lighting. And everyone's talking about LED lighting as being more... it's definitely lasts longer. The bulbs are more expensive, as you can see at Home Depot or Lowe's. They're more expensive, and they last longer. But according to Dr. McCullough, and I take a lot of faith in what he says because he's very well-versed and really knows what he's talking about, LED lighting can contribute to macular degeneration and eye issues, and that's pretty scary.
Oh, I see, because I sleep under a light bulb. I don't have a choice. I have a small room, and the light is over my head, and I sleep with it 24/7.
You can't turn it off?
Well, yes, I can, but I don't like to sleep in the dark. I'm more afraid of bugs and other things.
Oh. Well, remember the other issue, too, that we talked about, how good sleep goes with darker the room there is.
Probably losing some
It's more conductive for... Well, I know you personally like the light, but it's been proven that melatonin production is reduced amongst sound sleep does not occur unless you have total darkness.
I understand that.
So, yeah.
But now I wonder if your eyes are closed or covered with something, what is it when you're looking at something? Is it the glare? Is it a stronger glare? What's causing the...
I would have to look into that further because I basically just read through his article talking about how LED lighting was not safe and contributing to macular degeneration. So I would assume some sort of sunglass or those blue anti-blue light glasses that he talks about in the article might be effective for that as well. But I'd have to look into that further.
I see.
But obviously, turning off the light would be the best thing, but that's not an option for you. So I would try some sort of sunglass or some sort of material to protect the eye when you're sleeping. Even one of those, I don't know if you would like this, but you've seen one of those masks that people wear over their eyes, but you said you don't like total darkness.
No, not that much. But is there an article, is there a magazine or a newspaper where I could get this article?
You can go to Macola.com. If not, we can. You can call us back later, because I can't do it right now, but you can call back our staff later. Give us your name and address, and we'd be more than happy to send it out to you at no charge.
Oh, I really would appreciate that.
Yeah, definitely do that. So just call us back. You can leave a message, because we're actually closed today, or you can call us tomorrow and talk to Athena or Aaron, whoever answers the phone, and they'd be more than happy to take care of that for you.
Okay, because I don't have a computer, or I would do it myself.
I understand that. We can definitely take care of that.
That was Athena, or who, please?
Well, basically whoever answers the phone, but it's most likely would be Athena.
Okay, well, thank you so very much.
Well, you have a good day.
You too, and thanks again.
You're welcome. All right, I think we have another call. This is Dr. Pedduzi. Good morning.
Hello, good morning. Thank you for your show.
Oh, you're welcome.
Have you talked before, and I'd like to ask a question and hang up and listen to you, please, about the essential fatty acid supplements good for arthritis, or sometimes you say that if you're not getting benefit from hyaluronic acid and something,
yes,
you have a product.
Yes, I will definitely talk about that.
Thank you very much. Bye.
I say again?
Thanks for your show.
Oh, you're welcome, and thanks for the call. Oh, yeah, so definitely. I was actually going to get to that when we get into the nutritional segment and some of the products that I highlight from time to time, but we'll start with that since she mentioned that. So there's a nice product from Hope Science that just came out not too long ago, and a lot of people, have tried the glucosamine, the chondroitin sulfate, the hyaluronic acid. We have a great product called liquid glucosamine that in a liquid form that has the collagen, the hyaluronic acid, the glucosamine, chondroitin sulfate, MSM, all 5 of the top 5 joint repair supplements, joint lubrication, cartilage rebuilders, all in one product. But even so, some people don't respond to that. And they've had some great research, this company, Hope Science, on the esterified fatty acid complex, and they compared it to glucosamine, people taking glucosamine, and it showed that there was some great research published in top medical journals for some patients that had minimal results or no benefit with glucosamine and hyaluronic acid and such, did do well with esterified fatty acid complex. So, so we're seeing some good research with that. We have a cream as well as a capsule. The cream is topical, of course. It goes right into the skin, so absorption is very readily, and you put it right on the area, whether it's the knee, the hip, or any joints that you would like to put it on. And then the capsules, of course, you just ingest, and it comes in a capsule form. So patients are seeing restoration of joint health, improved flexibility, helping with pain as well, especially with the cream, the topical cream. So if you'd like to try the esterified fatty acid complex, it comes in the cream, the topical form, or the pill form. Right now we have to order more of the pills because I think we're out of that, but we do have the cream in stock. We definitely can get the pills for you if you need the pills as well. And there's some, even I mentioned this last week or the last time we were live, even some veterinarians that are using it on animals, and they're seeing great results with this product with animals as well, with arthritis and joint-related issues. So if you'd like to try, call our office, esterified fatty acid complex in the topical cream or in the pill form. Also, we have a great product called Progene for testosterone loss. We also have a take-home kit that you can do at home. There's a small cost with it, but it includes the shipping, handling, and all the postage. And it's a natural precursor. It's not actually testosterone, which, in my opinion, I think is dangerous to take in some cases because there's not enough research supporting it. But it produces testosterone naturally through natural herbal and botanical extracts. So there's a test kit that you can do at home to see, number one, if you have a low T-score. And if you do, there's a nice natural product called Progene 100% herbal botanical extracts known to support production of testosterone. So if you want more energy, if you want reduced belly fat, faster recovery, you may want to try this product as well. So just call our office. We can send it out to you for a small shipping fee, or you can pick it up and save the shipping. All right, we're going to get into the action plan for 2017 and the rest of your life. We talked about some of the things last 2 weeks ago when we were live. Giving up soda, of course. We talked about how soda and the addiction to soda can be similar to a heroin addict because of the dopamine production, which stimulates the pleasure centers of your brain, physically identical to that of heroin. So you can see why some people that try to skip or cut back on Coke, Coca-Cola, of course, and Pepsi, have difficulty. And then we know that artificial sweetened drinks are even worse. So Diet Coke, Diet Pepsi is even worse because of the artificial sweeteners. We're going to review some of the things we touched on quickly here. Number 2, eat an avocado every day. Rich source of monounsaturated fat in your body. As we skip on down, number 3, make fermented vegetables for family and friends. Number 4, donate blood and test your vitamin D and omega-3 levels. You touched on the importance of that. And the omega-3, which we all know, you can get naturally through wild-caught salmon, sardines, anchovies, herring, walnuts, almonds as well. If you need more, you can get a nice supplement. We have a great one here called Pro Omega CoQ10, which has the added benefits of the CoQ10 with a high level of concentrated form of EPA DHA. Most of your grocery store fish oils have a lot of fish oil, but they don't have a lot of EPA DHA concentration, so you're getting a very diluted fish oil that's not giving you many health benefits. Number 5, get more consistent and regular movement in your life. Talking about moving, we touch about that all the time, not sitting in a chair, moving around, using a stand-up desk rather than a regular one at your office will help with that as well. Getting a Fitbit, getting one of those things that counts your steps so you can see how many steps you're taking a day. The goal should be 7 to 10,000 steps a day, which is just over 3 to 5 miles. Number 6, eat more fish. We touched on that. But the importance of this cannot be overstressed for helping to prevent many things, cancer, improved overall health, reducing the aging process. Eat more fish. Number 7, go American grass-fed certified. Grass-fed beef, making sure that's imperative, again, because there's so many antibiotics and other drugs used in these concentrated animal feeding operations. You don't want that in your body. So again, grass-fed certified. Start peak fasting. We've talked about intermittent fasting and how that's important and how you can do it. And involves fasting for 13 to 18 hours each day, eating all your meals within the remaining window of 6 to 11 hours is a good way, an easy way of doing it. To make the schedule work, you need to skip either breakfast or dinner. A lot of people think that that's contrary to what you've heard health-wise. But no, occasionally doing this allows for better health. Which one to omit is up to you. However, if you choose to eat dinner, make sure you do it at least 3 hours before bedtime. We talk about how that can disrupt your sleep and cause problems with digestion. When you're sleeping, your body needs the least amount of energy. If you feed it at a time when energy is not needed, you end up creating a situation where your mitochondria create excessive amounts of damaging free radicals. We definitely don't want that. We know free radicals can lead to cancer. Number 9, eating. Get 8 hours of sleep each night. Sleep problems have the same effect on your immune system as physical stress or illness, which explains why a lack of sleep is tied to increased risk of numerous chronic diseases. Well, I've just touched on this with the lady just called. Recent research reveals being exposed to even dim light during sleep can have an adverse effect on brain functioning and other issues, even after a single night. If you're not sure how much sleep you're getting, a fitness tracker can be beneficial or helping you keep track the actual time you're asleep. Remember, there's the 33 ways to a good night's sleep that Dr. McCullough has. We can give you a copy of that article as well, touching on the importance of not turning on the light when you go to the bathroom, keeping the room as dark as possible, keeping the electromagnetic fields away from you, alarm clocks, cell phones, all those things, not having a TV in the bedroom, not having a cell phone or using a cell phone or electronic device within 30 minutes to an hour before you go to bed. disrupting, being exposed to that blue light, disrupting your good sleep. And finally, number 10, eating more fiber. Most Americans need to eat more fiber. A high-fat diet can help reduce your risk of premature death from any cause, likely because it can help to reduce your risk of some of the most common chronic diseases, including diabetes, heart disease, and cancer. I also have a nice article in my office talking about anti-inflammatory diet, and we touch on this on the show many, many times. If you eat a pro-inflammatory diet, a diet that influences or allows for inflammation production in the body, namely soda pop, again, meat that's grain-fed, too many grains promote inflammation, French fries, white potatoes, those type of things, promoting inflammatory cascades in the body. That also, inflammation is a leading cause of diabetes, chronic heart disease, arterial inflammation, clogging the arteries, yes, due to inflammatory production in the body. So by eating those foods that promote inflammation, you're just promoting problems down the line. So eating that anti-inflammatory diet as well as the high-fiber diet Dr. McCullough talks about is the way to go. Even if you don't have pain, in general, there's more to it than that. Of course, inflammation can lead to other health problems. So we have a nice handout. If you'd like a copy of that, call our office. We give it to every one of our patients that come through our door on an anti-inflammatory diet. So back to what he was talking about, eating more fiber, researchers have found that short-chain fatty acids produced by bacteria that feed on the plant fiber are major communicators. In other words, they actually communicate with your DNA, thereby providing protection against disease. When it comes to boosting your fiber intake, be sure to focus on eating more vegetables, nuts and seeds, not grains. Recent research confirms that in order to work, the fiber must be unprocessed. Processed supplement fiber, such as inulin powder, does not promote gut bacteria with what they need. Whole organic husk psyllium is a good fiber source, such as sunflower sprouts and fermented vegetables, the latter of which are essentially fiber preloaded with beneficial bacteria. Flaxseed, hemp seed, chia seeds, which you can just sprinkle on your salad or any of your food, are other excellent fiber sources. So again, finally, making a plan for life as well as the new year, 2017. Remember, most New Year's resolutions fail for one reason or another. So this year, try making a simple commitment to live a healthier from here on out. Start small and go slow, as little changes can make a big overall difference in your health. When you commit to a lifestyle, it's no longer about meeting a particular goal, like losing 10 or 20 pounds. It's about living a little bit differently, a little bit better, so that ultimately you're happier and healthier for it. So this, again, is from Dr. McCullough. Again, McCullough.com is his website, MERCOLA.com. Action plan for 2017 and the rest of your life. We also have the 20 health tips from 2016, his summary of some of his great health tips from last year. If you'd like to copy that article as well, you can go to his website, or we can send it to you. Just like the lady that called in, if you don't have a computer or printer, we would be more than happy to help you out and send it out to you free of charge. So next week, we're going to be touching on some of the natural preventative measures for menopause. If you're suffering from menopause, hot flashes, those type of issues, which are very, very discouraging in many cases and very disabling in some cases too, keeping you up at night and all the other things that go involved with that. We'll definitely be touching on that next week on BackTalk in the nutritional segment, so definitely stay tuned for that as well. We did touch on, again, if you'd like to visit our website, our web address is www.americanbackcenters.com with an S. Again, visit and learn more about VaxD therapy. Our other services, unique services we offer all under one roof, which we touched on today. We also have cervical disc treatment options, therapy and rehab, massage, orthotics, custom-made orthotics, nutritional consultations. We do x-rays in the office, nerve conduction, ultrasound testing, acupressure treatments. We also have a convenient MRI facility right across the street from our office. So many services offered all under one roof. We have a nice blog and patient education section. You can sign up for our daily health update newsletter. You automatically get signed up for the monthly In Good Hands newsletter when you sign up. It's a totally free service of the American Back Centers. You can meet our doctors, learn about our staff here at the American Back Centers, testimonials, contact information, and request an appointment right on the website. We try to get back to you within 24 hours for your requested appointment time. Again, www.americanbackcenters.com. Also, visit our Facebook page, American Back Centers Pittsburgh. If you have a second, just like our page. We'd appreciate that. You can see some of the great articles we've touched on this radio show. We try to update that to give you a preview before the show. So check that out weekly before the show to see what we'll be talking about. Again, American Back Centers Pittsburgh, our Facebook page. I want to thank everyone for being patient with me with my tooth issue today. I sound a little bit different, but I want to thank everyone for being patient, and we just got the beep there. So we're going to leave you with some final closing thoughts. Why would you even consider surgery when Baxi is available? Please be smart. Remember, surgery is a permanent procedure with possible permanent complications. Infection, bleeding, blood clots, scar tissue, and advanced degeneration can occur with any surgical procedure. And we talked about how the surgeries are not successful to start with. A smart, educated person knows this, who listens to this radio station and show, knows this, and will usually make the right choice for their health. I want to thank everyone for listening today. We'll be on next Wednesday and every Wednesday with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to BackTalk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for BackTalk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.